and I'm kind of retired, but not really. And this came about as a result of a faculty meeting a couple months ago when we divided up into small groups to discuss what we might do to enhance diversity and inclusion in the division. And one of the things we talked about that I put on the table is an R25 grant. And I'll tell you about that in a moment. But it is an opportunity that many of our fellow institutions use, and there are several already in the University of Minnesota. One of which is led by Colin Campbell. Colin, as you can see, is associate professor in pharmacology. He's DGS of that department and associate dean for graduate education in the medical school. I know Colin, and others of you may know him as the former chair of the faculty consultative committee for the university, probably the highest elected official representing us as faculty. So he has one of these programs, and I'm going to talk about the nuts and bolts of the program, and that's because I've been on that study section for NHLBI, for heart, lung, and blood. Other institutes have these programs as well, depending on topic. I don't know, for 3 or 4 years. And as recently as Wednesday, we had a Zoom meeting reviewing 5 institutions. So many institutions apply for this program and have these programs to enhance diversity. So what's the NIH goal here? Why do they have these programs? R25s cover a wide variety of education programs, but this specific subgroup is about enhancing diversity. But overall, the R25s are designed to improve biomedical, behavioral, and clinical research. And in this particular type of R25, it's to enhance diversity in those researches, biomedical, behavioral, and clinical, to train people to become active members of the research workforce. NIH at times has program announcements that they want certain types of people or specialties doing this, but most of these are generic, and the institution picks what topics they'd like to explore in their training program. And finally, the idea is by doing this, we'll all have a better understanding of biochemical or biomedical, behavioral, and clinical research. So who is the target audience here? I will mention URM, which is underrepresented minorities, but it is actually a bit broader than that. It includes African Americans, Latino Hispanics, Native Americans, Pacific Islanders, the disabled, and there are some criteria for that. Economically disadvantaged, there are criteria for that as well. And those that for their family, it's the first person to ever go to college. So these are the traditional people that are underrepresented in biomedical research. Now, like all NIH training grants, they have to be US citizens or green card holders. You cannot have foreign people in this program. And what is this specific program looking for? Well, it's looking for mainly college students, people who are in college, usually in their second or third year, or professional students, nursing students, pharmacy students, medical students. Indiana's program is dental students. but most are college students. And it's designed to give them a summer experience for training in a relevant scientific field. And obviously, in an 8 to 12 week summer experience, you're not going to become an accomplished investigator. But the goal here is to get people interested and involved. And I've seen in the programs, many programs spend some time with these students, teaching them how to take GREs and how to choose graduate programs or how to try to get into medical school, things like that, things that will enhance these individuals' careers and hopefully draw them in to a scientific field relevant to the NIH. So having just come from study section, I'm tuned in for this. What are the criteria? They are the traditional criteria, the 5 things we score on NIH grants, but they're obviously targeted to this specific program. And for significance, people write about increased disease burden in URMs, the lack, a very clear lack of scientists from underrepresented minority groups, and the advantage of having people from these groups doing research because they're more likely to have sensitivity to the particular needs and problems of their own groups. Things like this have actually been studied, and there is some scientific validity to that belief. What kind of investigators do you need? I'm telling you this because, you know, if we decide we want to do something like this, this is what it takes. So the program director, and there's a program director just like there is for our T32s or other programs, has to be a person with active NIH funding, has to be a person with a history of training students, not necessarily this group of students, but having done that, having trained underrepresented minorities and being involved with those communities is a real strength. And these programs all have multiple mentors. Usually students are assigned to one person's research or lab or whatever. And so you need to have a group of mentors bigger than the number of students who are funded by the NIH and hopefully have some training experience. There is an advantage if you have mentors that are from underrepresented groups. And all training grants, T32s, I've been on that study section, have more and more emphasized that you can't, some people are born mentors, but we can train people in mentors. And certainly the U has a program on this. Actually, CTSI had a grant for that. Then there is the thing we all struggle with, innovation in our grants. And in the many grants I've read, some people are very innovative in training. Some already, since I just did one on Wednesday, or did 4 on Wednesday, have confronted the issue of the pandemic. And how do you train people, particularly if you're training in lab science, if they can't come in, if they're doing everything on Zoom. And so you see some innovative strategies to do that. You need to be innovative in the recruitment and retention of minority students. And this is a particular challenge that all the centers face. Some of the models are people have connections with historically Black colleges and universities. We're aware those are other ways of approaching this problem. Actually, I'll talk a little while later more about this. Can you expose people to new experiences and ideas? I read one from California where a significant portion of their training was with biotechnology firms in the San Diego area. And do you have high-level evaluation methods to both examine people's experience, the quality of the mentors, and the ultimate career choices of the students that come into this? The programs tend to have a didactic portion. These are students that come in from a variety of backgrounds in college. Some of you, like me, may have been involved in Jim Neaton's SIBS program, the statistical NIH program for college students, and they taught them a lot of statistics during that time. So there's a didactic portion. There is always a research experience doing a project that may lead to an abstract or even a paper. Remembering this is an 8 to 12 week experience. There's involvement in ongoing seminars and workshops that the departments have. And here is the recruitment. So the historically Black institutions, Native American schools, other minority institutions. So one innovative model was from Texas that was linked to a very large historically Black college and had no trouble getting recruits for this program. A number of the schools go to Puerto Rico and recruit in Puerto Rico. A number have, and make the point, substantial number of graduates in their institution and have been growing that over the past 5, 10, 15 years, and so can recruit from within. So the approach needs to talk a lot about how you're going to find these students. And then current students, some places use their former students as recruiters of new students. There are a lot of innovative ways because a lot of folks struggle over this issue. Then there's finally, there's the environment. You've got to have the facilities to take care of these students. They, in general, live on campus. And so you need dormitory and eating arrangements, just as we did in Jim Neaton's program, which had 25 students. You need commitment from the leadership. And let me put this in perspective. This is a training grant. So first, it has 8% indirects like any training grant. Second, it's capped at around $120,000 a year in direct costs. So you need a stipend for the students, you need room and board. You know, most programs, the leadership and the mentoring is donated. There may be a clerical person, 20, 25% time that takes care of applications and problems like that. But most lean heavily first on their own units for diversity and inclusion, which may provide not only technical but monetary resources, and their own departments. Many departments, say we will pay the 10% of the faculty program director for this program, or frequently, some of the programs, for example, in San Francisco, where the cost of living is astronomical, and paying the kids $12 a day will not work to support them. And the university has, and provost or the department chairs have invested in that. And finally, to take 8 to 12 students for 8 to 12 weeks in the summer takes more than 8 to 12 mentors. You probably need a ratio of 2 to 1 to 3 to 1 because people go on vacation and don't want to take a student. So you need that basic commitment of your faculty to take on the mentoring role for students, just as you need commitment from the program director and department. It is most of the programs reach out to other departments that are working in similar areas and have mentors and support from those departments. So let me summarize. That's these programs, which are widely used throughout the United States, I don't think we've ever considered. I think it is an opportunity to interact with and begin groups of underrepresented minorities to have a career in our science and move forward to be contributors in that. It is not trivial work, and commitments needed, but I sensed in the time, many years I've been here, we don't have a clear pipeline for people like this to build them up and build them into careers that are important to science and important to our field. And we in public health, in some ways more than other fields, realize these are groups of people who suffer undue burden of disease and disability, and anything we can do to improve that and getting more people from those groups active as researchers is one way to improve that. So that's, I think I will turn this over to Colin, and we can have questions at the end. Colin, I see your face now. Welcome. And I'm sorry there were difficulties in this Zoom age.
Well, thanks for having me.
And then R25, and I think that will help all of us. I mean, I have a theoretical experience of reading grants, but I haven't actually had to do it. And you have, so your thoughts would be very helpful.
Well, thanks again, Russell. I appreciate the opportunity to come here. I didn't make any real prepared remarks. I've been thinking about it off and on for the last couple weeks, but I don't have a presentation. I think you did a fantastic job. You did all the work that I would have done if I didn't know I could count on you to do that. I did a wee bit of research. The University of Minnesota currently has 11 R25 grants. About half of them are in the medical school. There's a couple in BME. There's one in vet med. I think 1, 2, 3, 5 of them are actually affiliated with what we call the LSERP, the Life Sciences Summer Undergraduate Research Program. And they vary in size quite a bit from, relatively small 6 participants to, I think mine is the biggest right now at 22. They vary so much by institute and the focus and the emphasis. But I really love the way you set this up. It's got to be a labor of love if you want to do this. It is, frankly, the institution, at least the medical school, values indirect cost. And these grants come with very little indirect cost. You have to recruit a large number of your colleagues. And as a program director, I think your first loyalty has to be to the participants. So like a huge part of the job is what I call matchmaking, looking at the applicants, deciding who you're going to admit, and then trying to find a soil where that seed is going to germinate during that. For us, it's a 10-week summer full-time research, independent research program. So I would love to just like take questions if there are any. I don't, you know, like I said, Russ, you did a great job setting it up, and I can talk about anything that people want to.
Colin, I have a question to lead off. People are thinking, so how has it gone recruiting minorities here to the Twin Cities? Are they from the Twin Cities? Are you recruiting nationally? Are you going to Puerto Rico like some of my friends are in the winter to recruit?
Well, I've always been lucky in that I've been affiliated with the life sciences undergraduate research program for like 15 years now, a little bit more than that, actually about 18 years. And so the LSERP is what I call an umbrella organization. We've got about 9 different semi-autonomous programs that are all extramurally funded. And we have a common application portal. So students, and we have, I have a colleague, Danielle Watt, who replaced a former colleague, John Gottesman, who one of Danielle's jobs, she's full-time staff person. She's got a PhD and she did postdoc research. One of her primary responsibilities is to recruit for the life sciences program. So she does travel to historically Black colleges and universities, to minority serving institutions. She, not this year with COVID, but in normal years, traveling to, we have partnerships with a number of institutions, including the program, University of Maryland, Baltimore County, several of the historically Black colleges and universities, the Puerto Rico system. So she travels ordinarily around the country, and to Puerto Rico. She goes to the annual biomedical research conference for minority students and the SACNAS national meetings. So this common application portal, and we're also part of the Big Ten Academic Alliance. We get about anywhere between 350 and about 500 or so applications a year. And when students apply to the LSERP, they list their top 3 choices of programs they want to be considered for. So we have like a formula and a way that we do that. So there's been a great strength for me and for the other people that are affiliated with the life sciences program, because you have this massive infrastructure. We have a full-time coordinator, a staff person who organizes the travel, arranges the room and board for the res halls, takes care of the U cards and insurance, and does a lot of other work. So we have institutional commitment, substantial institutional commitment from the medical school. We have talented staff personnel. We have a track record. The life sciences program is 32 years old. We've had over 2,000 participants in it. We do longitudinal tracking of those students. Many of them are now professors. Former participants are professors. So it's been kind of easy for me, Russ. And there's, like I said, I'm just looking at my list here. Bob Mizell and Paul Mermelstein, who are both in neuroscience in the medical school, they each have R25s. Paul Molitor, who's actually in veterinary medicine, has an R25. Yoshi Shimizu has one, and I have one, and all of those R25s are affiliated with the life sciences program. I don't know that I would get funded if I weren't able to rely on that. I don't know, maybe I would, but it's just like it's been really helpful.
You have an infrastructure already available that I confess I'd never heard of, and I'm wondering if you obviously don't make decisions for them, but are they?
Well, I do. I'm actually the director of the LSERP also, so one of my other hats.
Well, then you're the person to talk to. If we in public health wanted to hook into this system, is that feasible?
It's definitely feasible. We'd have to talk about it. I think it would be very possible. We not to get bogged down in details, Russell, but like we used to go up to the field station at Lake Itasca, and we had a limit of how big we could be because there's only so much space up there. But we're not going there anymore. We're trying to save money, and that was a little bit expensive. So We're not as capped now. We had about 80 we would have had 80 participants this summer if the program hadn't been canceled. So we can get bigger. And as you know, at the U of M, big is good. I think that it's possible. There are some marginal costs. We do have a, I forget what they call it, that internal fee-based system. So we do charge people a per capita fee to be in the program, because the grants just never cover all the costs, as you pointed out. In fact, they're woefully inadequate. So we do have to, some of the people, when they write grants, they put money into the budget to cover that. But sometimes the money has to come from other places as well, other institutional sources. So I think it's a real opportunity, Russ, and candidly, public health is really, I'm preaching to the choir, right? It's really important. It's really important and well recognized by many of the young scholars of color and from underserved communities that apply to our program. And it's not what we do. None of the modules in the life sciences program right now have a public health focus, and it's a loss for us, frankly. So I can't make a promise on the spot here, but I would be very, very favorably disposed to considering this.
Well, that's fantastic. I mean, I've learned something tremendous already. Let me throw this open to other questions to Colin or to me.
I'm seeing some questions here. So what are the best metrics that, why don't people just ask me questions, if that's okay?
You can, some people put questions in chat.
Hi, Colin and Russ. This was great. I'm Teresa. I wanted to know, I'm a co-director of a T32 on population health here at the U. I enjoyed hearing about the nuts and bolts and about this network that you've set up, Colin. That seems amazing in terms of recruitment. What are the success metrics that NIH looks for? That was my question in terms of what participants experience. So is it things like publications or scientific presentations, or is it about enrollment in graduate school research jobs? You said faculty jobs, so that's a very long-term outcome, but I'm interested on what they look at.
So Teresa, thanks for the question. And just to make it clear, I didn't start the LSERP. It predates me by a wee bit, but I was honored to be asked to take on the director position, which I've been happy to have for quite some time. I just say it, I am looking for somebody to come in and work with me and replace me at some point. So that's a discussion for another day. But yeah, I think that, the NIH, they ask for publications every year, like any research. It is an R grant, it's not a T grant. So even though Russell's right, it is really a training grant, but it is an R grant. So they ask us every year for publications, and it's disappointing. We have very few. I mean, 10 weeks, inexperienced person, almost impossible. So we get a couple of papers, maybe one paper every year or two. We have 22 participants, so it's very hard. But the primary metric that we push is future matriculation in an advanced degree program. We think that a PhD, a research-based program, is the primary measure of success. But we also say that going to medical school or vet school or dental school also counts. So this is a real tension because you're right, it's a long timeline. We do try to, I think from an intervention standpoint, and public health people know this, the earlier you intervene, the less it costs and the more effective you are. Recruiting students that are trying to decide between a clinical or research career, getting them after their freshman or sophomore year makes a lot more sense than waiting between junior and senior year. But if you want to get good outcomes in the short term, go after students that are going to go to graduate school and get them to come to your program this summer before they apply to grad school. So cynically, that's kind of where most programs go. So we've actually found that it makes a lot of sense for us to go after some of those younger students because we're, UMBC, University of Maryland, Baltimore County, it's where the Meyerhoff Scholars Program is. They've done amazing work. We get a lot of their trainees because a lot of summer programs won't take rising sophomores. So we do. We think it's important, but it's hard because they're not going to graduate for 3 or 4 years, and they may just decide, or for whatever reason, not pursue that research career. But we think those are the primary outcomes. It's a diversity program. Not all of them are as tightly tied to race and ethnicity as some of them are. Depends on the institutes. Like Russ pointed out, the NIH has expanded their definition of underrepresented in ways that I think are fantastic. So we try to capture all kinds of diversity, economic diversity, disability, geographical diversity. We definitely focus on non-UMN students because we get over $100,000, more like 150 from the medical school, and they want us to contribute to the diversity mission, and that really means getting students from other parts of the country, East Coast, West Coast, down south. So we do recruit nationally, and we take any success we can get. The dean would like us to have more of our former trainees matriculate at U of M, but we take success as broadly defined as possible.
I also had a question about this network that you have. The network is do the students get to take advantage of the network? Do they all live together in the dorms maybe?
Yeah, they do.
And do they have common seminars or common training or common social networking?
Yes, they do. We do less of it now than we used to do 15, 20 years ago. We used to, my predecessor was really big on doing a lot of stuff, and the PIs wanted the students in their lab. So it's an independent research training opportunity, and so we minimize that. We do have programming in the evening, like 1 day a week. There's a lot of socializing though. They live together and they eat together, and that ends up being really important. And students have told us, I would love to take credit, but I'm not that arrogant. We give the students a great experience because they have 70 colleagues and friends. When you go to a program and there's 6 students in the program, there's probably not somebody like you. You come to our program, there's going to be several people that you really bond with, and it's been fantastic to see how the students keep in touch for years and years after they've been in the program. So
yeah, that's amazing.
It's been really great. I feel like I was born on 3rd, and I'm bragging about hitting a triple. I kind of inherited this program, and so I've just been able to just live the benefits.
Yeah, let me, Teresa, just add from the standpoint of a person who reviews programs in their 2nd, 3rd, 4th 5-year period. Obviously, early in the program, if you're taking college students, showing long-term success is impossible. But first, you got to track these students for forever because you need to be able to say that. And yes, many programs do not have significant research productivity at the end of sometimes only an 8-week experience. They may get their name on an abstract. I think that some have dealt with this by keeping students more than 1 year and bringing them back the 2nd summer, where you're hopefully more prepared. I just wanted to point out something Nancy Sherwood put in the chat box, something I didn't know, that Jean Forster had a cancer-related health disparities program. I don't know how long ago, so we aren't starting from zero, but obviously she doesn't have it anymore. Other questions?
Yeah, Russ and Colin, this is Ryan. A quick question. Thanks, great presentation. This is really interesting and valuable. So it's a 2-part question. First, I'm wondering how much success you see with programs, or is anybody proposing at all the use of digital and online technology? It sounds like the coming together and living together is an important piece of it, but we struggle in Minnesota having local diverse populations to bring in, and we may do better if we can integrate some online distance, at least as a portion of it. It also cuts down on infrastructure costs. And the second part of the question relates to how much do these successful applications leverage existing infrastructure and resources? So I was a part of an R25 several years ago where the R25 sort of funded people to come and be a part of a summer institute. And as a result, we could get a lot more done with the R25 because the summer institute infrastructure was there and we didn't have to build it. And it benefited the institute because it brought in more people, and it benefited the R25 because it helped meet its objectives. But I don't know how successful those approaches usually are.
Russell, you have a more global perspective on online training. I can talk. I'd be happy to about what we did this summer online, but I'll let you go.
Here's what I learned on Wednesday. There was only one institution. I happened to be reviewer on it. I won't tell you who, but it's in the northwest part of the country, right up there near Canada. And they were the only one we were reviewing for renewal. They've had 10 years already. And obviously because they did, they had a class this last summer and struggled with that. And it's a program, and I suspect Colin's is a program like this, that is a lab-based, wet lab-based program. And the challenges of trying to do wet labs distance is probably hopeless. So they struggled with that. Then somebody raised the question in the study section, well, what about new programs? Obviously, their first potential class is summer of next year, 2021, and no one knows where we'll be then. And we were told the NIH policy on this is not to have any expectations of putting together a virtual learning program for new grants. Now, maybe it's because they're optimistic about the vaccine, or maybe it's because no one's exactly sure how to do this. Having said that, I think teaching in public health, well, first, having helped my grandson with his biology class in high school, which is all virtual, I can see the problems of doing an experiment that way. But public health, I personally don't think distance learning for something like this is ideal because of many of the both educational things and things Colin was talking about, the interaction between students and living together. But we're not so equipment and lab bound as the laboratory sciences are. So if we were to go in, we won't be obligated to present a virtual program, at least as of Wednesday.
Thanks.
And I think you're right, Ryan, about you really are, if you're gonna be successful, you have to really indicate how you're going to leverage existing institutional resources. Like I said, I'm bragging about it, I guess, but if you tap into the LSERP, I think that you tick off that box really well. If you're not going to do that, I think it's really critical that you have something else going for you to achieve that objective.
I think, again, it's fantastic, Colin, that this exists. I mentioned the SIBS program in biostat that I taught in, and I know Pam taught in, and some other people did as well. But it ran as an isolated program. Now, they had 25 students, and they lived in the dorm, but I never heard any talk of any other program that they were involved with. Everything from going to a Twins game to the ice cream social they did by themselves. But
so much work.
25 is a reasonable number to do things too.
Yeah, you get a critical mass there. It's just so much work to have to contact the travel agent and to yep. network with the, so it's hard enough to get somebody to think about putting one of these together without telling them they're going to have to do that other stuff as well. It's a heavy lift.
Can I ask a question, Colin or Russell? I'm Diane Newmark-Steiner, and I chair our division. I'm wondering if you could talk to us a little bit about the actual experience, what students do when they're here and what their mentors are doing. And then also I was wondering if we did want to link up to your infrastructure, what would be the first steps to do so?
So most of the programs, Russ, I'll take this one if you don't mind. Most
Please.
of the programs in the LSERP, essentially all of them are wet lab based programs, although even within that context, every once in a while, there's a student who's doing more of a computational project. One of the modules is a computational neuroscience. So we're not rigid about that idea about whether you would have to do it that way or not. We do insist that students participate in our core activities, which are minimal. When we have an orientation program, we just think that those sorts of things are really, really important for building community. We get them for 3 days or so. We do an extensive orientation to community build, which I think is really, really, really important, because we then do set them free and they scatter all across campus. Even some people go into St. Paul campus, and it's just really important to us that we build and maintain that community. So the students are going to be the youngest, least experienced person in that lab. They're unmoored from their normal support network. The vast majority of the students have in their parlance, an awesome experience. They really love it, and it's enriching and confidence building. We talk about credentialing students, mostly by getting them into a prestigious program and getting them to do research with a person at a R1 university, but we also credential them in soft ways. People leave our program feeling like they know what it would be like to be a PhD student. Like, I can do this. I saw people like me. I can see myself doing that. So that's a huge part of what we're trying to do. Every student has to prepare a poster. We have a poster, and we partner with other on-campus programs that are not affiliated with the life sciences program and physical sciences and social sciences. We have a big thing that we usually do in the alumni center in the McNamara every year. Several hundred, about 400 or 500 undergraduate researchers. So yeah, I hope I got your question.
So if we were going, what would be the first steps if we wanted to link up to your infrastructure?
Oh yeah, just talking with us, and I would have to consult with I do have a colleague, Danielle Watt, who is she's the other half of the leadership team of life sciences. She'd have to be supportive, which I suspect she would be, and then we would negotiate about making sure that you're going to be able to cover the marginal costs. So LSERP does pay the coordinator. We provide a lot of services, but
Right. Yeah.
we need to know that you're able to pay the residence hall, and there's a small cost that we charge for the stuff that we do. So just put the green eye shade on and talk to your finance person and make sure that we have that it's going to make sense space wise and philosophy wise, and then money wise.
Okay. Thank you, Colin. Thanks, Russ.
Yep. Other questions? Well, no one ever attacked me for getting a meeting over early. As a matter of fact, some applaud when you do that. But I want to thank you, Colin, particularly. I mean, the purpose of this so-called seminar was for us to learn more about what opportunities existed, and we sure have. And you were a great help in learning about what's being done on campus and what possibilities there might be.
Well, Russ, if anyone's interested, shoot me an email and we'll have a Zoom meeting, whoever you are, if it's more than one of you, Danielle and I, and we can really talk in a way I think that would be very practical, very focused.
Well, it would be fantastic. As I've read these, developing an infrastructure is not a trivial task. I know for the SIBS program, I mean, they had a full-time person for 6 months arranging travel and room and board and all these things, which on the surface seem, oh yeah, we could do that, but somebody's got to spend time doing it. So
Also, just super quick, Russ, somebody asked about a high school program. There is just a recently funded R25 at the U of M Medical School that is focusing on high school kids. So you could go that route if you wanted to. You can have medical students, you can have current graduate students. But Russell's right. Most of these, I think, are focused on undergrads.
yeah, I haven't seen, like I said, I've seen a couple with professional students, but you know, those are people who are not only URM, but they're already in the system.
Yeah.
They've made
Michelle
it.
Allen and Chris Pinnell just got an R25 funded to work with high school students out of the Cancer Center.
Uh-huh. Okay. Well, thank you very much, everyone. And thank you for Colin for educating us about this. And thank you to all who attended.
Teresa may have another question. Do you have another question, Teresa?
No, I just wanted to make sure if any, there was a student, Delilah, who was speaking on the chat, and I would be very interested to hear her perspective because she said she participated in a program like this and it was really important to her. But I also don't want to put her on the spot to speak with all of us because it could be, you know, intimidating, and I want to support her. So, but I would be very interested to hear the student perspective. Mark was saying that we may have another opportunity to hear more from students at a different time.
Yeah, I'm okay with just talking a little bit. I was a non-traditional student, so I was a little bit older. I went into my first kind of like pipeline program, what they kind of call these where it's like they're trying to create more, get more minority students in medical fields or, you know, science related fields. So I did my first one at Sanford Research in South Dakota. And I thought I was gonna work in advertising. Like that was what I was gonna go to school for. And I'm American Indian, and I learned about what health disparities were, and I learned about just some of the health conditions that American Indian people face. And I knew that that was my family. And I was like, wow, there's a name for this. And that was in 2013. And I worked with this German scientist and tested HPV, oral samples for HPV. And it was just like blew my world, like I was doing this. So, and then the next summer I went to the Native American Research Internship at the University of Minnesota and worked with an environmental civil engineer. And I tested water samples from my tribe for endocrine disruptors. So, and then I graduated in 2015 and I did the Native American Research Internship at the University of Utah allows you to do 2 summers. And I did another summer where I worked in more of a clinical setting because I just didn't have the hard science background to be like, I didn't take a lot of like biology and chemistry. So I knew that that was going to be an issue for me. So I wanted to get more of a clinical experience. So I worked with some neurologists in the stroke center there. And that was really interesting because I got to shadow like telemedicine with the tribe. And I also got to like shadow in the clinic, like clinical research. I got to watch like open brain surgery, which was very intense. And I realized that the direct medical service wasn't for me. And right after I got out of that internship, I went and worked for a biobank for a year. And I realized that that wasn't for me. I realized that I really needed to be working with American Indian populations. And then I started working for the American Indian Cancer Foundation as a research coordinator. And I coordinated 5 research projects there. And now I work at the Indian Health Board of Minneapolis, and I do a lot of program coordinating around sexual health. But this program has allowed me to understand how to write grants. I actually helped write part of that Chris Parnell grant 2 years ago because ACAF was going to partner with them. I don't know where that went because I had left that organization. So just being able to like learn about how to apply for grants. And then I'm also in an American Indian Cancer Control Research Fellowship. So I just recently received $30,000 to do my own research. So that went through the IRB, and I have a mentor. Her name is Dr. Melanie Nadu. She works at the University of North Dakota, and she works in their Indigenous health, and she's mentoring me, and she got her PhD in epidemiology from the University of Minnesota. And now I'm really pushing hard to see if I can graduate from my program by the end of in a year. So I might be able to get there, but I think that the major thing that this program gave to me was like the confidence to know that I could do it. A lot of networking and partnership, like professional and with other students. And I feel like I've built a lot of skills in 5 years. Because I wouldn't say 5 years, it's about 7 or 8 years. I built a lot of skills, and it's just, when I saw this, I was like, when I saw this webinar, I was like, this looks interesting. I'm gonna see what the School of Public Health is doing. So, and they paid, so they stipend, and they paid for everything. And some of them paid better than others. So, and that is a factor for people who are minority students or underrepresented students. So, and then we got to go to conferences. I learned how to make a poster. I learned how to write an abstract. I learned how to present. And then some of my research did receive awards, because I think that the prevalence of oral HPV in Northern Plains American Indian women, there wasn't a lot of work in that field. So I've just met a lot of, been able to network with a lot of well-known American Indian health professionals, and I wouldn't be here without these programs. So if anybody has any questions later, they can email me or contact me. Anybody from the School of Public Health. Sorry, my printer's going off.
Thank you so much for sharing. We're so lucky to have you in our program.
Yes, Diane, this is Jamie. I just wanted to say that I have Delilah's in my women's health class, and she just brings such a wonderful perspective to our class, and that many of the other students have commented that they really value having her in our program. So I think Delilah, her experiences and she's just a tremendous, I don't even have the words to say it, but our program is much more valuable and beneficial and a place of learning for students when we can bring in students from diverse backgrounds.
Yes, definitely. Well, Dahlia, thank you. Your experience is fantastic, and I think helps inform us, and may continue to help inform us if we go forward with something like this. So much appreciate that experience. Any other last comments? All right, thank you, everyone. I had, I confess, not the highest of expectations for this seminar. I didn't know what was going to happen, but I'm coming out of it incredibly optimistic because of what the things Colin said, things that I think most of us didn't know about, and what others have said. So thank you all.
So long, everybody. Nice to meet you.
Thank you.